Good afternoon. I hope you're enjoying this terrific weather we're having today. I would like to welcome you to the ninth and little tear shed final, but it's actually good news that it's final, of our weekly COVID panel discussions with key community leaders. This is an event organized by Tallahassee Memorial Healthcare and reflects amazing cooperation and collaboration across the entire Leon County healthcare community. I would like to recognize our key partner, the Village Square, which continues to promote civil discourse and discussion in our community. A special welcome to our radio audience on WFSU, which is broadcasting this Monday at 7 o'clock. My name is Skip Foster, and I will be your moderator. Before we start, if you've missed any of the prior 8 webinars, there's a ton of information that's still relevant to you on those, as well as a comprehensive FAQ document and lots more information at tmh.org/coronavirus. And before we start, and just before I kind of finished my script, I moved this up to the top. I just want to tell all of the folks that are watching, find a way to thank a healthcare worker or anyone that is a part of that community, including their families. See if you can find a way to do that. They are giving a lot at their own physical peril and at oftentimes work that takes a severe mental and emotional toll, and they're doing that just to keep you safe. It can be thankless work, and I just can't think of a better time or opportunity to write someone a note or call or text them or do something nice for them that have been in this siege we've had now for more than a year. Anyway, and it goes without saying, thanks to the amazing folks on this screen that have taken even more time out of their day to do this webinar and keep you informed. So here's how this is going to work. We're going to start by going around the horn and spending a little time with Ms. Blackburn, and then we're going to talk about life after the pandemic with a special guest today, Dr. Carina Blackmore, who is the state epidemiologist, director of the Division of Disease Control at the Florida Department of Health, a bona fide bigwig that is here today to look into her crystal ball and tell us as much as she can, at least about how she reads that crystal ball and the information that'll be coming in. But in the meantime, Claudia Blackburn, also with the Department of Health, the health officer here in Leon County, there's been a lot of news this week. So I'm gonna throw about 4 questions at you and see how many you can remember. The first is just kind of give us a data picture, right? And then if you can update us on the governor's expansion of those eligible for the vaccine. I think starting now, it's 40 and up. So Dr. Robinson, we're almost to your age group. We're not quite there yet. And then maybe, I think some folks probably that are in their 40s haven't really been paying attention to what's going on with those old people. And so maybe just kind of walk them back through how this is supposed to work and what they're supposed to do. So there's a mouthful. Take it away.
Sure. Thanks, Skip. Okay, well, our trends right now in Leon County are very encouraging. Our positivity rate for the past 2 weeks has been about 2.5%, with about 32 cases per day on average. And 40% of our cases are in the 15 to 24 year age group, and that group accounts for about 23% of our population. So you can see that we have a disproportionate number of cases, as we have had in that age group. So we'll be happy when we can start vaccinating that age group. About 4% of our cases have been in the 65 plus age group, and that group represents about 14% of the population. So that's the decline that we were happy to see, and it has stayed at about 4%. And this is the group, of course, that is at the highest risk of severe illness, hospitalization, and death. So we're, very happy. Happy to say that our vaccination rate is, we're at 77% of people 65 and over who have had at least 1 dose of COVID vaccine. And in addition to healthcare workers, and people considered to be medically vulnerable by their physician. The 50+ age group is our current target, and we are at 59% of this age group having received at least one dose. There are still 37,000 people, though, that are 50+ that need to be vaccinated in Leon County. As you mentioned, the governor announced yesterday, I believe, or the day before, that the eligible age will drop to 40 on Monday, March the 29th. And then it will be 18+, pretty much everybody that the vaccine, is made for, can be vaccinated beginning April the 5th. So March the 29th for 40+, and then April the 5th for 18+. And there are about 189,000 people yet to be vaccinated in Leon County when we get to that 18+. So we're going to have a lot of work to do really fast. And we hope that the vaccine will start flowing in, because we are really excited about the opportunity to be very busy getting shots in arms. I just want to, for those people, like you said, that it's not been on their radar, they can go to myvaccine.fl.gov to learn about their options, to pre-register. There are lots of options. And if they want an appointment with the health department, they can make an appointment through this website. But there are lots of other options: TMH, Publix, Walmart, Sam's, the CVS on Thomasville Road, the FAMU Al Lawson Center, Bond Neighborhood, FSU, and many faith-based missions that are going on. So lots of different options in the community. Okay, so I've said my piece. I just want to say one last thing, and that is that, we're all here. We're the face of our organizations, but I have an incredible team behind me, and I just want to give them a shout out, because they have done a tremendous job and continue to. So thank you, and I'll pass the baton back to you, Skip.
Okay, so I want to follow up with two things. The first is a question for me, and then we're getting a lot of questions all on the same thing. So the first is, talk about how you kind of envision supply and demand, maybe comparing it to the 65 over time. How is, so we got, you said 200, what was the number, something thousand that needed to get it? And
about 189,000.
Okay, so just under 200,000. And if you total up the vaccine that we're getting in the county per week right now, what is that number? Do you know?
I wish my crystal ball was clear. If we kept getting exactly the amount that we're getting right now, it could take a few months to get through that, but we anticipate that the supply is going to increase. I don't really have any visibility into that, but I mean, that's kind of what we're hearing nationally.
Do you know what do you only know what you got this week, or do you know what came in if you aggregate all of the locations?
I have some idea. It's probably, this is really rough, maybe okay. 500 doses a week coming into the community.
Yikes. So that's got to ramp up pretty significantly if we're going to get 189,000 people vaccinated. Okay. And then the question there's a lot of folks, and I saw something on Twitter on this, just it kind of passed over my eyes, about 16 and 17-year-olds. And what's going on there with it? There's one question that isn't the Moderna have a lower age level? What can you tell us about 16 and 17-year-olds once the April date arrives?
Right, and let me just say that number that was a rough estimate. That was for prime doses. That was for first dose, not for second dose.
Claudia, I'm sorry, I think you broke up, because what people heard you say was 500 doses, and it broke up. I'm getting texts. So.
Oh dear, no, 6,500.
Oh, okay. Yes, I heard 500 too. So.
Oh no! Oh heavens,
that.
No.
Okay.
About 6,500. And it could be more. I don't have all of the pharmacy data.
And that number's got nowhere to go but up, right? As more of the Johnson & Johnson comes online and that kind of thing.
Yeah. Okay. So Pfizer is for 16+, Moderna is for 18+.
Okay.
J&J, Dr. Watson, correct me if I'm wrong, I think that's 18 plus. And I would imagine that we'll get more guidance on what the rules are. And Dr. Blackmore shaking her head, so she can probably clarify for us.
Okay, so what I think what the question is on April 5th, if will my 17-year-old be able to get a vaccine, or is it only 18 and up?
I suspect we're going to see an executive order that clarifies that.
Okay. Okay, great. Okay, well, that's a lot of great information. We'll come back to you, Ms. Blackburn, but I want to now turn to Dr. Dean Watson, Chief Integration Officer at Tallahassee Memorial Healthcare and Capital Health Plan. Is the news, Dr. Watson, still good when it comes to the hospital's numbers? And I also wanted to ask you about, I know FSU didn't have a spring break, but there's been spring break at some of the lower schools, and what can you tell us about the potential impact of that?
I'm sure. Yep. Thanks, Skip. We at TMH, I can tell you specifically that we have 7 COVID patients in the hospital. I do want to remind folks, we review everybody daily, obviously, and a majority, and I shouldn't say majority, at least half of them did not receive their vaccination. They're over the age of 60. I cannot emphasize enough that this is real. Please get vaccinated. That people are still being hospitalized, and it's unfortunate when we go to evaluate folks and they've declined the opportunity for vaccination, and that's a little sad to me. But back to the spring break question, you're correct. So Florida State made a decision, and many universities made a decision not to have spring break, but clearly watching the news, there are plenty of people heading to South Florida and other locations. And what the middle schools, high schools, and others did have spring break. We'll see the effects of that, if there are going to be any effects over the next few weeks. And we hope for the best. Now, I will say this, most colleges do virtual classes. So even though there weren't spring breaks, I'm sure that the kids were enjoying some opportunities out there using their virtual capabilities, which clearly they didn't have when we were in school, Skip. But well, I shouldn't assume for you, but for me, they didn't have them. So, but we will see the end results of that starting probably now. And we are hearing some schools locally that have had some positive cases, and it's not going to be a surprise.
My horse and buggy was one of the first ones with cruise control. So that was a great way to get to school. Hey, let me follow up with a couple of viewer questions for you, Dr. Watson. One is, boy, and I can empathize with this. If I'm still on steroids after my COVID, does that have any impact on when or if I should get the vaccine? So I'll let you take that one, and then I got one more.
Sure. And so we all do, everybody on this call uses the CDC guidelines for vaccination post-infection. And I would tell you that how we handle it here at Tallahassee Memorial and other local facilities is we look at 2 weeks post-infection is kind of how we run with it, if they're asymptomatic and can receive it, up to 90 days, right? Because that's where all the studies are, up to that 90-day period. And we're sure that the antibodies will be present beyond that, but we stick with CDC guidelines. We also tell folks that if you're on steroids, we really would like to see you come be off the steroids for a few weeks before vaccination to get the maximum benefit of the vaccine. Now, if you're chronically on steroids or you are on immunosuppressants chronically, get the vaccine. I mean, I can't emphasize that enough. But when we do have people ask us questions about the steroids, it's really, we would like to see you off for at least 14 days prior to vaccination.
And then thank you for that. The last viewer question I want to get to before we keep going around the horn is, are there any facilities or medical practices locally or anywhere nearby that are specializing in COVID long haul conditions, this kind of long COVID?
That's so funny. I'm going to ask who that was that sent that, because I was getting texted yesterday by my friends west of us that were talking about their long haul symptoms, and we call those chronic sequelae and of a disease. And right now you see practices that are just starting to work with or develop processes to evaluate and treat this. We're so early into this disease process, we're just beginning to see these practices to develop. Bigger cities are moving a little bit quicker on developing practices that focus specifically on COVID-related sequelae or long-haul symptoms. Tallahassee, obviously, you need to be seeing your doctors, working with them. And again, we're going to be a little bit slower in developing specific specialties for that. The resources are a little bit different, but our docs are really good at treating all of the sequelae, all of the long-haul symptoms locally.
Great. Thank you, Dr. Watson. I want to now turn to Dr. Temple Robinson, CEO at Bond Community Health Center. They're doing amazing work there. Dr. Robinson, what's the latest from Bond?
Well, we're getting about 800 doses per week in. And those are first and second doses, a little bit of Johnson & Johnson. We're happy to report that we will be partnering with Neighborhood Medical Center and Leon County and the Department of Health this weekend to do a community vaccination clinic. And I'll let Ms. Freeman talk more about that, I'm sure, when her turn comes. But we are excited that the eligibility criteria is being opened. This is what we've been waiting for, and we really now have to double down on getting people vaccinated. That's just where we are. We're trying to bend this curve of these folk that do not want to be vaccinated. And I'm so disheartened when I hear of colleagues that are in the hospital very, very ill. And then they come out and they say, I didn't get vaccinated. So then I'm asking these people now, would you be advocates for others to let others know that it's important to get vaccinated? So that's where we are. And I want to thank everyone here for working with us. This has been marvelous what we have done. We have supported each other, and we still have a lot of work to do. And you know, Bond stands at the ready to help out.
Thank you so much for saying that, Dr. Robinson, and for everything you're doing. You mentioned Janae Freeman from Neighborhood Medical Center, which broke the news to me that I had a positive test. So I'll forever have Neighborhood Medical Center on my mind. Ms. Freeman, tell me what's happening there.
I'm so glad you cleared that up, that we didn't break your nose.
Just my heart.
Good afternoon, everyone. Neighborhood, we're still testing. I do want to emphasize the importance of still testing for COVID-19. It's not gone, it's still here. People are asymptomatic still. So we're still seeing some numbers, nothing like what we were seeing before when this first started, or even 3 months ago. So that's definitely good, but we definitely want to encourage people to continue to get tested. We are still vaccinating as well, like Dr. Robinson mentioned. We've partnered with some amazing people in the community to do a pop-up vaccination clinic this weekend. It'll be at the Roberts and Stevens Health Department building in New Mount Zion Church. We'll be outside, drive up, walk up, testing, vaccines as well. So we are definitely excited to try to decrease some of that vaccine hesitancy in our community. We're now able to order vaccines from the federal allotment, so we're excited about that. Neighborhood Medical Center has joined the cohort, so hopefully we'll get some of those by next week. Not sure what the availability will be, but right now we do have access to the Moderna vaccine, and hoping we'll get some of that J&J as well.
Great, thank you, Ms. Freeman. Senator Loran Osley. Senator Osley was demoted by whatever knuckleheaded moderator we had last week who called you representative. I'm glad you've been reinstated to your rightful position in the Senate. Tell us what is happening from your vantage point at the Capitol, Senator Osley.
Well, I'm excited to hear about the supply coming in, and you know, I'm focused on all the counties. I've been calling through my health departments, and I think, you know, everybody's handling this. I know that the floodgates are going to open on April 5th, I guess. And, you know, Janae and Temple and I were on a call about Gaston County this morning. I think Gaston County's under, you know, in good shape. We're trying to pull all the partners there, just like we're doing here, and feeling good. And just want to say thank you to everybody. And I'm going to get my vaccine. Going to get my vaccine today.
Great. Thank you for being here, Senator Osley. I want to go to Kevin Peters now, Leon County. I see you on, Mr. Mayor. I'm going to circle back to you to wrap us up at the end, if that's okay with you. Great. Okay, Kevin Peters, what's happening with the county?
Hey, good afternoon, Skip. Three things, and one of them's been mentioned, but it's the partnership with Bond and Neighborhood for a pop-up vaccine clinic this weekend, working with those two organizations, and that'll be a great opportunity. Number two, we're partnering with ESP Communications, that communications group to help with outreach on reducing vaccine hesitancy and general COVID-19 awareness for the community. And then the last thing, coming on Monday, the county is going to launch a vaccination locator map on our county's website. We're going to consolidate all the information, the different places that are offering vaccine on a easy to use map. It'll also have all the directions on where to go to sign up for the different sites. I think our only operating site that doesn't require a pre-registration routinely is the Florida A&M vaccine site. Obviously, we have some pop-ups that may not require that, but if we're talking about some of the pharmacies or even the clinic when the health department runs it, usually there's a pre-registration process. So all that information will be included on the map with all the available locations, and we hope that'll make it easy for our citizens here in Leon County to find a vaccine location so they can get ahead of this virus and help end the disease.
That's great. Thank you for that, Kevin. I now want to turn to our special guest, Dr. Blackmore with the Florida Department of Health, who's going to give us kind of a epidemiologist view of what the future is going to look like. I promised I wouldn't put her on the spot and ask her for specifics or anything like that, because I know there's a lot that's uncertain. So Dr. Blackmore, can you please give us the exact date and time when we won't have to wear masks again? No, that's not my question. See, just making sure everybody's paying attention. Seriously, tell us a little bit about what epidemiologists do, the data you're looking at, and kind of the process you'll go through. You've got the mayor of Tallahassee here and a senator and somebody with Leon County. When you're feeding them information, how do you get that and what is it? Thank you for joining us, by the way.
Thank you so much for having me. So epidemiologists are medical professionals who study diseases at the community or population level. So what we do is we collect data and analyze that data then to help us understand who's at risk for certain diseases and what types of human behaviors like wearing masks or participating in sports or medical interventions like vaccines that put people at risk for the disease or may help slow down or stop the spread of disease. We also investigate and help control outbreaks. We have infectious disease epidemiologists both at the state and the county health departments, and many of Claudia's team members are part of this EPI team. And we focus on investigating about 100 or so diseases that are reported to the department by healthcare professionals and laboratories. And COVID, of course, is one of those, but you may have also encountered our team members before. For example, when we investigate outbreaks of foodborne diseases, sexually transmitted diseases, vector-borne diseases, and outbreaks in daycare centers. So again, we collect the data then to help us understand who is ill, where they got ill, when they got ill, and how they got ill. So we use laboratory data. We look at medical records, and we also interview the patients to learn more about their symptoms and their potential exposure history. So then we put all that data together and put it out in various types of reports or maps with recommendations to the partners that we work with, like the schools or businesses or regulatory agencies. And in this case, our community and policy leaders to help guide then disease control measures that are needed. So we also very interested in addition to looking at who is at risk for the disease, we also want to know who gets most seriously ill and pass away from that illness, because those individuals, of course, are the ones that we want to protect the most. And then we evaluate the various types of disease interventions that are recommended to try to figure out how effective they are. So, for example, we will be looking a lot at the vaccine data moving forward to see both at who is getting vaccinated and who is not getting vaccinated for a variety of reasons, of course, but also looking at the efficacy of that vaccine effort.
So, Dr. Blackmore, what are the one or two key thresholds that you'll be looking at when it comes to this, return to normalcy that we all hunger for? And in particular, I know kind of early in the pandemic, there was a lot of talk and kind of misinformation about herd immunity. And some people said it was 30%, and some people said it was 80%. Is that a number you're looking at? And what are the hard kind of data points you're focused on?
So we're still learning about this virus. And we certainly have some idea what to expect based on what we know about other viruses, other coronaviruses and other viruses that have this kind of outbreak potential like COVID does. I mean, herd immunity is something we don't know for sure what that number is for COVID. We know it's going to be high. The majority of our population has to have either been infected with the virus or been vaccinated before we would consider us to have a herd immunity. So I don't really think we're there yet. Obviously, we would want to get everyone vaccinated, or a high proportion of all age groups vaccinated before we can start talking about herd immunity. I know, for example, that they're working on pediatric vaccines, but we probably will need to see pediatric vaccines too before we get to that point. So I would say that the most important indicator to watch are the number of hospitalizations and deaths, because that is the most important piece that we make sure that our healthcare infrastructure can operate and care for all these patients that they have in the best possible way. So those are very important numbers, and these also would show or indicate perhaps if they start to go up again, whether we are seeing any changes in the virus. I certainly hope that these numbers will not go up again, but if the virus continues to change and evolve and mutate, that might be something that will happen. And if that happens, we would need to then look at modifying some of the vaccines we have and give people booster doses like we do, for example, with flu.
Okay.
But the best way of...
I need to interrupt you because we need to say goodbye to our radio audience with WFSU, and thanks to them for joining us during this series. Okay, now continue. Sorry about that. We just had a little
no problem.
There. Go ahead and finish your point.
I was just going to make a plug for vaccinations, because the best way of making sure that does not happen is for as many as possible to get vaccinated now. The vaccines that we have now are very effective against the viruses that we have circulating right now.
So there are folks, as you know, that fear that there'll be an argument from public health people and people like you that we should kind of never go away from masks and distancing, and that should just become a way of life. Then there's people that are hoping that's the case, that are really super fearful of catching things and would love for that to be the standard. And of course, people wore masks at airports before anybody knew what COVID even was. How would you respond to both of those groups?
Well, epidemiologists, I mean, our role is to provide the data. The decisions about the policy that comes from these data are left to various types of leaders, community leaders, business leaders, etc. But we are absolutely going to be taking a very close look at the data after the pandemic, or at the latter half of it, where we are now, because what we have seen is that while COVID has, of course, been raging in our communities, there are other very serious respiratory diseases that put people in the hospital that have not. Flu in particular is what I'm thinking about. And so we've had a very mild flu year, and we don't quite really understand exactly what we did this year as a result of COVID that also helped us lower the amount of flu transmission we have in our community. So trying to understand that and see if there are practical guidance that we can then continue to recommend, that then would limit the number of hospitalizations, and that's that we typically see to flu every year in the older community. That will be something that we will be looking at closely.
So Mayor Daley, I know I said we were going to wrap up with you, but I think this is what Dr. Blackmore just said was interesting. And I don't want to put words in your mouth, doctor. But basically, I'm an epidemiologist. I deal with data. I turn that data over to decision makers, theoretically you, Mr. Mayor, and they decide what to do. That's interesting because, you know, what you hear a lot of folks in government say is, well, we're going to follow the science. And that sounds a little bit, so how do you hear what Dr. Blackmore just said, and how does that factor into the process the city will go through to decide what happens next?
Well, first of all, Dr. Blackmore, thanks for joining us. Certainly do appreciate it. And before I give any comments, I once again want to thank the entire medical community for everything that you've been doing. Under the leadership of Claudia Blackburn over the health department, you've done a tremendous job serving as our overall coordinator. Dean, Talis Memorial, and the Ally Hospital, Capital Regional have done a tremendous job being community partners. Temple, Janae, cannot say enough about Bond and Neighborhood. And of course, my great friend, Kevin Peters. Golly, if it's a global pandemic or a hurricane or whatever it is, you and your team are always there to help us out. And of course, the city of Tallahassee, we know our role, help with logistics and to help carry the message. And we will do everything we possibly can in our role in the global pandemic. Specifically to your question, and Skip, by the way, thank you also for moderating along with the TMH marketing team these weekly Friday video chats. They've been fantastic. A lot of positive feedback about it. So look, when you look at the city of Tallahassee elected officials, myself and my 4 colleagues, and when you look at the 7 electeds at the county, it is no surprise that none of us have a background in medicine. I mean, we are elected lay people. So it is important, and in our community, I think it's been a tremendous success, the working relationship that the government has with the medical community. We listen to you and your advice and your interpretation of the data here locally, and we take seriously all recommendations on how we can move forward in a positive impact. I know that sounds kind of hokey, Skip, but it's true. And it is important that we sit back and listen to our local doctors and the medical professionals about what's going on in our neighborhoods. That's why I think that our community has been somewhat successful throughout this entire pandemic, and that the decisions that are made are based on recommendations and suggestions based on the science from the professionals. When it comes to specific action right now, you know, the big question is the mask mandate and where does it go from there? And I know that my colleagues at the county, and I'm sure Kevin can speak to this as well, they review the data on a weekly basis. They are in tune to what's going on, and they are going to continue to make the decisions that are best for our community. And I support them in those efforts as well. As we move forward, as Dr. Blackmore mentioned, and we have all discussed earlier, if things do happen that causes us to come back to the table to discuss how to keep the population safe, of course, we're going to be there and we're going to do the best job we can to stay safe. And as we move forward with more vaccinations, and we're all so impressed with the logistics of the medical community here in Tallahassee and what they've been able to deliver, we are going to be there every step of the way. But I can't stress enough the fact that the 12 electeds from the city and the county, not one of us are doctors. We do not have medical backgrounds. We are elected lay people. So it is so important for us to listen to our local medical community to help guide us make the right decisions. And I don't want to put words in anyone's mouths, but I hope you feel proud with your elected officials with the decisions that have been made based on your recommendations. We have got an incredible working relationship, and I'm just proud to be part of the team.
Thank you, Mr. Mayor. And County Commission Chair Minor was unable to be here today, but did send me a note and wanted me to pass along that the mask mandate does remain in effect, and he urges people to continue following that, as I know you do, Mr. Mayor, until we're told otherwise. So the last question for you, Dr. Blackmore, and thank you so much for joining us. You have really added to our discussion in an important way. And then I'm going to come back to Dr. Watson with a couple of viewer questions that have come in. I just want to talk about acceptable risk for a second and get you to respond to that. So, you know, people died from the flu every year in this country, in this state, and we said that, you know, we're willing to accept that risk as a part of living our life. With COVID, we said, yikes, that's risk we're not willing to accept. And so we changed the way we live because of that. How does acceptable, and you know, there's acceptable risk when your kid goes and plays youth football. Every time you get in the car and drive, we make these trade-offs all the time. I guess I'm interested in how you evaluate that trade-off, and what does that kind of look like going forward for COVID?
Yes, so we, as epidemiologists, we measure risk, and I think with COVID and all the unknowns, that it's well known that people are more nervous about risk when they don't understand it. So that is, I think, is part of what is happening with COVID, in addition, of course, to the big impact that it has had on our healthcare infrastructure, which is absolutely a real thing. And so whether that risk is acceptable or not is something that is we then look to others to help us decide, the medical community, the policy makers, and the personal decisions that you just referenced, Skip, and that will change over time as we become more comfortable with a situation, or whether when our healthcare infrastructure, like in this case, has changed. So it's absolutely a trade-off. So what I think, though, with COVID is so important to consider when making these trade-offs is that whether the COVID exposure that a young person has might directly or indirectly, through contacts with friends, for example, result in putting family members or other older or vulnerable people in our lives or in the lives of our close contacts at risk. And that, of course, is especially important, or has been especially important during this time when we have had a very stressed healthcare system that we worry may not be able to then care for these people adequately. That I think is the most important piece that people get the care that they need.
Yeah, that's excellent. That makes a lot of sense. Dr. Watson, I want to come back to a couple questions we had in the chat pertaining to post-vaccine sickness, right? So I think we've kind of all heard that, you know, some people will be scot-free, others will feel a little puny. And the question here is, where's the line on feeling a little puny versus, hey, Houston, we have a problem. And, you know, when should someone get tested or contact their doctor, where's the kind of line there for post-vaccine issues?
Yeah, great question. Before I answer that, just let me, from TMH, CHP, I got the blue and white behind me for both. I just want to echo what everybody said on here. It's been just an absolute thrill to work with you, Skip, on this, and everybody on this screen. We've been friends for a long time, the majority of us on this screen, but what an amazing job this group has done, bringing the best, in my opinion, some of the best care related to COVID in the country. And I'm just so proud to, and TMH, CHP, have all been proud to be a part of that. But and honestly, Leon County and surrounding counties should be very proud of what we've done. So to answer your question, remember, and I always enjoyed when I was heavy duty in practice and people would say they got the flu from the flu shot. No, you didn't, but you did have an immune reaction, which is a good thing. And I will tell you all, when I had a Moderna vaccine, I was never so excited to have an immune reaction more in my life than when I had it to this vaccine, because it showed signs that, you know what, my body's producing, my body's reacting, I've got antibody production, this is awesome. So what I would tell you is that how we market is that when you get your vaccine, expect to have some sort of reaction, whether it be sore arm, whether it be a little bit of a fever, chills, sweats, whatever. That's exciting. You should be happy about that. The problem, the issue becomes really if it lasts longer than 72 hours, then I would tell you, okay, here's the deal. Please communicate with your provider if it's something that is progressively worsening. For example, if you're short of breath or the shortness of breath is worsening, if your fever is persistent and will not go away, nausea, vomiting, diarrhea, things like that would make you say, yeah, this is a little bit more than just a vaccine beyond that 72-hour mark. I would also tell people on the second shot, if you're not Johnson & Johnson, that's a one-shot deal. But if you're getting the second shot Moderna or the second shot Pfizer, you will have a little increased immune reaction, right? Because it's a boost effect. Your body's been exposed to that antigen or to the antigen production, and now you're going to have a little bit of a hyper reaction. That's okay. Again, celebrate the fact that your body is reacting to the vaccine, and your immunity will build to a point where you are going to be protected to the best of our ability. So again, it's that 48, 72 hours. Beyond that 72 hours, contact your physician. And if you are having significant symptoms, contact them earlier, like the shortness of breath or the extreme fatigue. Can't get out of bed. Well, that's an issue. We need to hear from you.
That's terrific, Dr. Watson. Okay, this is it. I feel like Old Lang Syne needs to start playing or something, but this is our final of these webinars. It has been a true honor to facilitate these and help these experts. I'm decidedly not an expert. These folks are, and I hope you learned a lot. This is not the end of our discussion and our communications, though. Please regularly check tmh.org/coronavirus for the latest news, new public health guidelines, and more. If there's a change in circumstance, we might pull this group back together and do this again. If you've got any questions, I know there's ways to submit those, and we'll work on getting you answers. So keep in touch, and thank you to every single one of you on this group for what you have done. Really appreciate it, and know that it was a time you could have been spending doing other things. So be safe out there, everybody. Keep informed, stay in touch, and I hope everybody has a great weekend. Thank you.